Hi, my name is Mona Hardas and I'm a cosmetic gynecologist from Michigan. Today I wanted to give you some information on monsplasty, or it's also called as a pubic lift. So mons pubis is an area, it's a kind of a triangle shaped area which starts at the top where the pubic hairline is and goes in a triangle way down where your genitalia starts. So it's a looser area covered with hair, but a lot of time the fat accumulates in there. So sometimes when people gain a lot of weight, they gain weight down there. Sometimes people have tummy tuck surgery or abdominoplasty surgery, and at that surgery the fat is removed, the abdominal part is taken care of, but people forget the pubic area. So that fatty area, it protrudes out. It looks like a protrusion of a fat and extra skin. It can show through your clothes. It can cause a problem during sex because it can kind of come over the vulva, and it's difficult during and painful actually during sex or even urination, and keeping the area clean gets difficult as well. Sometimes after bariatric surgery people lose a lot of weight, so the fat from that pubic area is gone but the extra skin hangs out there. So when we do this monsplasty surgery, we actually remove the extra fat and the extra skin as well. So the surgery is done usually in a hospital basis or in a surgical like outpatient facility. The surgery is done under anesthesia. Either it could be full general anesthesia or it could be an IV sedation with the local, depending upon how much of the skin and a fat we have to remove. So during the surgery, we give a horizontal incision. Now, this incision will be in the hair bearing area so nobody can see it. It will be covered by your bikini, so even you will not be able to see it because the hair grows on the top of it. So, with that incision, we take the extra skin and extra fat out and we tighten the muscles inside. Now, all the stitches are dissolvable stitches, so they go away in few weeks time. So few things before you have the surgery done. Number one will be obviously do your research and find out a cosmetic gynecologist who has done enough of these procedures so you feel comfortable and confident about your surgeon. Number two, because the surgery is done under anesthesia, you have to make sure you have a ride to the hospital and a ride back home. You're gonna be a little uncomfortable after surgery for a few days, so you are gonna need some help at home. If you are taking any pain medications, aspirin, ibuprofen, please stop those medication at least a week prior to surgery. Now, this is a very vascular area and it can bleed. So, we have to do everything to make sure our bleeding is minimal. Same thing if you are taking any herbs or over the counter medications, make sure you stop them for a week before surgery. No alcohol for at least 2 days prior to surgery. The surgery itself is short, less than an hour or so, but because of the anesthesia, after surgery, you're gonna be a little sleepy and groggy. So you're gonna need help getting to the bathroom and walking. We do want you to walk and move after surgery, but because of the discomfort, the walking is going to be a little bit slow. You will be given pain medications to take home, which we would tell you how to take after surgery is done. Now, the stitches which are there, they dissolve completely, they don't need to be removed, but that area needs to be kept clean and dry. So make sure you maintain a good hygiene and make sure you follow up with your surgeon. We usually like to see our patient a week after the procedure so we can check the incision, and then we see them a month later as well. So because of the stitching and because of the tightening of the muscles in that area, we'd want you to avoid any heavy lifting or any kind of a straining. So no straining during bowel movement. So avoid constipation. Make sure you hydrate yourself well, and no sex for at least 4 to 6 weeks after surgery. Monsplasty surgery is pretty common. It is done mostly either by the cosmetic gynecologist or plastic surgeon. We offer the procedure in our office, so please come and see me if you need to know, are you a candidate for this surgery, number one, and how much extra skin and fat needs to be removed. It changes from person to person. Now, a question I always get asked is about, what about liposuction? Yes, liposuction can be done in the area, the mons area, and fat can be removed. But if you have excessive skin, then even after the fat removal happens, the skin can hang out and you may need the monsplasty. So it's really important to see a trained surgeon to decide, are you a candidate for liposuction, are you a candidate for monsplasty, and how much of the tissue has to be removed. We will discuss all that in details when we see you. Again, our information is down below. Please call us or contact us, and we will talk in details at that time.